Assalamu alaikum. Please start the session.
Assalamu alaikum. Bismillahirrahmanirrahim. Life is a series of thousands of tiny miracles. Notice them. My topic of presentation is influenza, which is one of communicable disease. Learning outline of my presentation is background, epidemiological determinants, clinical feature, level of prevention, global influenza surveillance response system, and recent advances. In the end of this session, the participant will learn about influenza infection, level of prevention, and recent advances. Burden of disease. It is truly an international disease. Worldwide, the annual epidemics are estimated in about 4 to 5 million cases of severe illness and 3 lakh to 5 lakh deaths, which are annually reported. It spreads mostly with travelers worldwide. This was the history of different influenza pandemics, which was occurred like a Russian flu, 1918 flu pandemic, Asian flu, Hong Kong flu, 2019 flu pandemic, and these are the years. The last pandemic which was reported is 2019 to 2010, and you can see that there are different subtype of influenza virus which was present in this pandemics. There are different strains of the viruses. The last pandemic is in 2019, which affect almost 53 countries, and it started in the March 2019 and then spread 2009 and then spread to different countries, almost 53. There are 15,510 cases and 99 deaths were reported in this pandemic. Now we discuss the epidemiological determinants. There are mainly 3 factors which is discussed. First one is agent factor. The agent which is responsible for influenza infection, it is influenza virus, which is RNA enveloped virus, and it belongs to orthomyxovirate family and 0.28 to 0.12 micron in diameter. There are 3 main subtype of this virus, A, B, and C, and the main responsible the infection, it is the heme agglutinin and neuraminidase, which is present on the surface of this virus, and you can see in the structure of the influenza virus. There are mainly 3 types of influenza virus, type A, type B, and type C. And type A mainly affect humans and animals. Type B affects human only, and type C also affects human only. The types are divided on different antigenic, on the basis of different antigenic. There are different subtype of these main types, and mostly epidemics which was occurred in worldwide are due to type A virus with different subtypes. What is antigenic drift and antigenic shift? This is the difference. There is a difference present in this. In antigenic drift, there are a minor change within subtype, and in shift, there are a major change in the subtype of virus. Point mutation is occurred in drift, and exchange of gene segments is occurred in the shift. Drift is occurred in A and B subtype, and shift is occurred only in A subtypes. Main cause of epidemics are antigenic drift, and main cause of pandemic are mostly antigenic shift. This is the example, and you can see that in the antigenic shift, there is a total replacement of the strain of virus H3N2 is replaced H2N2. And in antigenic drift, there are a minor change. In antigenic drift, there are only a small mutation which is occurred in the uh, type of virus, and antigenic shift, there is a formation of new strain. Now, host factor. It affects all ages, both gender affects equally, and there is no as such a role of lifelong immunity in the influenza virus. It is depend upon the subtype specific, and antibodies against HA and NA are important in the immunity. Environmental factor. Overcrowding, it is mostly occur in winter season in northern hemisphere and throughout the year in tropical countries. Chain of transmission. The main reservoir of this influenza virus is animals or bird. Source of infection is cases and subclinical cases. Period of infectivity. Nasopharynx from 1 to 2 days before and 1 to 2 days after onset of symptoms. How the virus is spread. Mode of transmission. The virus is spread by droplet nuclei and droplet infection, and the main organ and the main system which was involved in this disease is over respiratory tract. Common sign and symptom of this disease is respiratory. It is basically a respiratory disease, abrupt onset of symptom with high grade fever, chills, body aches, sweating, dry cough, nasal congestion, sore throat, headache, malaise, and fatigue. The complication with influenza virus, mainly primary influenza viral pneumonia, secondary bacterial pneumonia, croup, myositis, myocarditis, toxic shock syndrome, and Raynaud syndrome. Now we discuss the level of prevention. There are three level of prevention: primary, secondary, and tertiary. In primary level of prevention, there is a health promotion, and we can done the health promotion by educate the people about wearing mask, exercise regularly, vaccinate, eat good and healthy food, frequent hand washing, enough rest, avoid the rain, and avoid the close contact with the patient. And in specific protection, there is a vaccination of this disease is present. Two type of vaccination: inactivated subunit and live attenuated vaccine. Inactivated subunit mostly used intramuscular. It is trivalent, and immunity which is produced with the vaccination is 1 year or less than 1 year. There is no lifelong immunity with this vaccination. And in live attenuated vaccination, mostly it is used as intranasal. It is also trivalent, and immunity again 1 year or less than 1 year. These are different type of influenza vaccine. Inactivated subunit, which is used intramuscular and intradermal. Live attenuated is used as intranasal, and trivalent vaccine, mostly it is also an inactivated virus. In this vaccine is present type A, type B, and there are different strain of type A, which is present in trivalent. And quadrivalent influenza vaccine, introduced for the 2013 to 2014 session, contain the same antigen, with the exception that quadrivalent vaccine contain two type B strain. Vaccine virus are grown in chicken egg, and the final product contain residual egg protein. The vaccine is available in both pediatric and adult formulation. This is the vaccination schedule, which is followed in developed countries. The vaccine is in age group which are included in this schedule is 6 to 35 months, 3 to 8 years, and above 9 years. The dose of pediatric group is 0.25 ml, and 1 or 2 doses are given. And 3 to 8 years, the dose is 0.5 ml and 0.5 ml. 2 doses at least 1 month apart for children receiving vaccine for the first time. There is no routine immunization against influenza is here in Pakistan. What are the reasons for getting yearly flu vaccine? The first reason is that because flu virus are constantly changing, flu vaccine may be updated from one season to the next to protect against the most recent and most commonly circulating virus. The second reason that annual vaccination is recommended, that person immune protection for vaccination decline over time, and annual vaccination is needed for optimal protection. This is the composition of vaccine, which is used from 2019 to 2020. So you can see that there is a 1 year production of influenza vaccine. And in next year, the composition of the vaccine is changed according to the strain of virus. Level of prevention. In secondary level of prevention, there is early diagnosis, and how we can early diagnose the disease. There are different laboratory techniques which are used. Rapid diagnostic test, it gives result within 30 minutes, and there are 70% sensitivity and 90% specificity of this test. In serology, we can use paired serum sample, and more than 2 weeks are taken for the result. Viral culture is a gold standard for this uh, influenza virus. Influenza isolate for the vaccine development, and real-time PCR is the most sensitive and widely available test. Immunofluorescence technique, it requires intact cell and laboratory skills. And in the secondary level of prevention, we can prompt treatment of the patient of influenza virus, and we can done the treatment with antiviral drugs, mainly M2 ion channel inhibitors, in which amantadine and rimantadine are included, and neuraminidase inhibitor, Tamiflu and Brilenza. Tamiflu in the form of tablets and Brilenza in the form of inhaled powder. Contraindication of vaccine. If there is severe allergy to chicken eggs, then the vaccination mostly not given, and if it is uh, given, then with precautionary measures. Severe reaction to previous vaccination, develop GBS within 6 weeks after getting vaccination, and children less than 6 months of age. Difference between human influenza and influenza pandemics. Human influenza basically a public health problem each year, but in pandemics, this is appear in public unpredictably. In routine influenza, some immunity have developed from previous exposure if the subtype of virus is same. But in pandemics, there is no as such immunity in the population. Infants and elderly at more risk, all ages, increased risk of serious complication. Human influenza due to result of antigenic drift, and pandemics occurred due to antigenic shift. What is avian influenza? Bird flu. Disease that spread from bird to bird. It can spread from birds to human, but not easily. Risk of becoming pandemic influenza, but this is not happened yet. But it can kill so many chickens. There is a proper global influenza surveillance and response system was present, which is initiated in 1952. The mission of this system is protect people from the threat of influenza by continuously functioning as a global mechanism of surveillance, preparedness, and response of seasonal pandemic and zoonotic influenza, global platform for monitoring influenza epidemiology and disease, global alert for novel influenza viruses and other respiratory pathogens. Now, recently, what has happened? WHO consultation to adapt influenza sentinel surveillance system, including COVID-19 patients. The e-consultation will provide a global forum to review and adapt existing influenza surveillance system for COVID-19 in a way that would ensure a valid and continued interpretation of surveillance information for both influenza and COVID-19. What are the objective of this system when they combine both? The overall aim is to frame in term operational consideration for adapting and sustaining influenza surveillance system at the global, regional and national level to understand timely the co-circulation of influenza and COVID-19, review evidence and experience of countries in using influenza surveillance system, develop interim recommendation for adapting and sustaining influenza sentinel surveillance to ensure continued influenza surveillance and wherever possible monitor COVID-19 virus transmission in community. What are the expected outcome? Epidemiological and laboratory recommendation that will be plotted in the coming northern hemisphere influenza season and update understanding of scientific base for sentinel surveillance of influenza and COVID-19 virus. Outline of agenda, review of evidence, sharing of country experiences, review influenza surveillance standard in the context of COVID-19, discuss and recommend interim adaptation to sustain influenza sentinel surveillance and monitor COVID-19 transmission in community. There are different participants which is involved in this system. These are the references of my presentation. Now it's time for the MCQs. Virus such as influenza, which emerged suddenly and spread rapidly worldwide.
Pandemic.
Correct answer. The influenza virus is mainly controlled in special risk sector by hygiene. No, the correct answer is vaccination. Most pandemics of influenza virus have arisen from which of the following animals? Pig, bats, wild birds,
Wild birds.
correct answer C. The influenza virus have complicated genetics due to which character? Genetic reassortment amongst genes, high level of recombination, rapid adsorption at fusion, high fidelity RNA replicase enzyme.
Rapid adsorption.
The correct answer is A, genetic reassortment amongst genes. Antiviral drugs can be used therapeutically if administered within 4 days of clinical sign, if used within 48 hours of first clinical sign, used for the obese, used in children below 2 years if virus spread is high. B. Correct answer is B. If used within 48 hours of first clinical sign. Which type of influenza virus cause more epidemics? Correct answer. Which of the following signs you need to see urgently at the doctor? Dry cough, shortness of breath. Correct answer. What is the best time of year for person to be vaccinated against influenza? In autumn, just before the peak flu season. In summer, before the next peak flu season. Flu symptoms develop. Autumn is correct answer. When the global influenza
1952.
Which is the gold standard test for detection of influenza virus? Serology.
Virus isolation.
This is the key of MCQs, and thank you.
Thank you very much. This was a very good presentation. As we all know that influenza is an infectious disease which has caused many pandemics in the past. Spanish flu was the largest pandemic in the history which has affected millions of people in 1918. As this is an RNA virus, it is notorious for its mutations. So vaccinations should be recommended for high-risk groups such as elderly and immunocompromised populations. Now my question is, what is the difference between droplet nuclei and droplets? Anyone from the class?
Droplet nuclei are
droplet nuclei are dried form. It lacks moisture, whereas droplet are containing moisture content. Droplet nuclei are of smaller size.
The size of nuclei is bigger in droplet infection and droplet nuclei is more than 5 micron is droplet infection and less than 5 micron is droplet nuclei.
And droplet nuclei have poor rate of survival. It can survive for years in dust, etc.
And it is mainly formed from the evaporation of respiratory droplets.
And one thing is
Droplet
known,
nuclei.
nuclei can travel more than 1 meter.
5 micrometer in diameter, generally smaller than droplets.
Yes,
Droplet nuclei.
correctly said. Droplet nuclei are smaller in size, whereas droplets are larger in size. The size of droplet nuclei is less than 5
Micrometer.
micrometer, and droplets are more than 5 micrometer. Droplet nuclei remain suspended in air for longer time, so they cause more airborne transmission. If anyone has any question,
Thank you.
thank you.
Allah Hafiz ji, thank you so much.